Okay, so in that video we will going to discuss about MRSA. So before going to start this video, I would like to recommend you to go and watch the first video on the staphylococcal aureus infection treatment. Okay, that will help you to understand about the staphylococcal aureus infection treatment part 2. So although I will going to give a quick recap that in part 1 we have learned that we at first generally using penicillin types antibiotic, but staphylococcus aureus evolve themselves and make them capable to produce a special type of enzyme called beta lactamase. This beta lactamase have the ability to destroy the beta lactam ring. Okay, so for preventing the destruction of the beta lactam ring, we are using clavulanic acid. We have discussed about. Under such circumstances, there is a special type of new beta lactam antibiotic developed. I have told you, that is methicillin. Okay, so this methicillin have a special property that their beta lactam ring cannot be destroyed by the beta lactamase enzyme produced by those bacteria. Okay, and as a result methicillin resistant staphylococcus as a result those methicillin antibiotics can do their job fantastically, and which ultimately causes death of the organism. Okay, so under such circumstances staphylococcus aureus again evolved themselves and learned to express a special type of gene called MAC-A. This MAC-A, after transcription and translation, leads to the production of a special type of PBP. Okay, so this PBP has a special type of characteristics. What kind of characteristics? The characteristics is our beta lactam antibiotics cannot do anything to those special PBPs because they cannot bind or they cannot fit well with these special PBPs. Okay, so if you try to think that here clavulanic acid cannot save us, because clavulanic acid was usually used to stop the beta lactamase activity, right? So that is the reason why staphylococcal aureus strain who have the ability to express MAC-A gene are the strain which cannot be treated with any kind of penicillin or any kind of beta lactam antibiotic that we have discussed until now. Okay, and these kind of strains are known as methicillin resistant staphylococcus aureus. Okay, so we have started our journey from penicillin. So by learning the mechanism of penicillin, staphylococcal aureus have understood that if I want to survive in that environment, then I have to do something for myself, right? So they have acquired the capability to produce beta lactamase. Okay, so what is the utility of this beta lactamase? This beta lactamase have the ability to break the beta lactam ring of the penicillin. Okay, so now under such circumstances we have tried to use methicillin. Okay, so because methicillin, the beta lactam ring of the methicillin is not destroyed by beta lactamase. Okay, so under such circumstances staphylococcal aureus say us that okay, so you guys are doing something new, then I will try to do something more. So he learned to express MAC-A gene. Okay, this MAC-A gene have the ability to produce a special type of PBP protein. Okay, this special type of PBP protein cannot be destroyed by any kind of beta lactamase we have learnt until now. Why? Because methicillin and other penicillin cannot fit into them. Okay, and as a result methicillin and older penicillin becomes ineffective against those kind of special strains of staphylococcal aureus. Okay, so these strains are known as MRSA. So there are two kind of MRSA. One is healthcare associated MRSA, and another one is community associated MRSA. So here I want to clear one thing, that you will get such kind of resistant strain only in those places where there is a over usage of antibiotics. Okay, because in the antibiotic lecture series, during the first video of drug resistance, we have discussed that due to the evolutionary pressure, bacteria have acquired new adaptation that help them to survive even in presence of the antibiotic, okay, to which they are susceptible. So remember it very carefully. Not only MRSA, but any kind of resistant strain that you have you have to learn in your future, all are due to over usage of antibiotic. Okay, so healthcare associated MRSA, as its name suggests, this is mostly found in hospitals and nursing centers, okay, where there are lot of chronically ill patients and a high usage of antibiotic. Okay, now again community associated MRSA. So community associated MRSA, as its name suggests, this MRSA will be present in community, okay, and is thought to be due to rampant antibiotic use on factory farms and over prescription of antibiotics. Okay, so the first one, that is HAMRSA, you will find HAMRSA in any hospitals and nursing centers, okay, where there are lot of chronically infected patients and a high usage of antibiotics. And in community associated MRSA, what is going on? It is mostly present in communities, okay, so where there is a rampant usage of antibiotics on factory farm and over prescription of antibiotics. Okay, so in that picture we have learned about the basics of methicillin resistant staphylococcus aureus. Okay, so it have the ability to produce a special type of gene called MRSA. This MRSA giving them a special type of protein, which is the modified PBP. Okay, this modified PBP cannot be affected by methicillin or other kind of older beta lactam antibiotics we have discussed, okay, because they cannot fit them into those specially modified PBPs. Okay, and here we have discussed that MRSA can be divided into two types. One is healthcare associated MRSA, another one is community associated MRSA. In healthcare associated MRSA, found in only hospitals and nursing centers where there are lot of chronically affected or chronically ill patient and a high usage of antibiotic. Okay, and in community associated MRSA, CA-MRSA found in communities, okay, and is thought to be due to rampant antibiotic usage on factory farms and over prescription of the antibiotics. Okay, so now both HAMRSA and CA-MRSA is not a good news for us, because any kind of beta lactam and antibiotic cannot do anything to them. Okay, under such circumstances we have decided to use another type of antibiotic. Okay, so here in that case we have changed the antibiotic class, so we will now going to use glycopeptides. For example, let's say vancomycin. Okay, so although here the effectivity of that antibiotic is low and it often associated with some side effects, so along with this, what do you think? Staphylococcal aureus can now be defeated, or staphylococcal aureus will again play some magic? So we will going to discuss what staphylococcal aureus will do against vancomycin in our next video. Just a hint that staphylococcal aureus cannot still be controlled with the help of this vancomycin. Okay, so there will be another new adaptation that staphylococcal aureus have adapted to protect themselves from vancomycin. Okay, so you know what we should learn from staphylococcus aureus. It can adapt, it can every time eager to learn new things for its own protection and growth, right? So just joking, that is not a good news for us. So that is the idea for methicillin resistant staphylococcus aureus. So in the first video we have discussed how staphylococcus aureus resist penicillin, and in that video we have discussed how staphylococcus aureus resist methicillin. Okay, and in the third video, which will going to be the last video of staphylococcus aureus, we will going to see how staphylococcus aureus resist vancomycins. Okay, that is VRSA. Okay, so it will be also a very interesting lecture, so don't miss it. So thank you for listening to this class.